The purpose of this brief tutorial is to illustrate how the digital scans that are not waterproofed uh, can be manipulated and have the work bases added to them prior to tooth separation and resetting of the teeth. Okay, so we're going to grab a model. And I know that I have some models right here. This is the upper one, and this is the lower one. Actually, these are not models, they are scans. So they're basically just the hollow skins. They are a product of an intraoral scan. So these are the ones that I wanted, so I'm going to select those, bring them into Maestro. The initial presentation is a little busy, so I'm going to turn off some of the extra views. And what we're looking at now is the presentation of those scans from a perspective of the intraoral scanner, which doesn't happen to coincide with the perspective of the Maestro software. So I'm going to make that adjustment. As you look at this diagram here, the green arrow is supposed to be pointing up, the blue one forward, and here we have the blue one pointing up and the green one pointing back. I'm going to highlight this ring and just rotate everything forward. It's a little bit like a Rubik's Cube. And then I'm going to move the entire contraption up, and you can look and see the shadow line right here. Move it right onto the upper teeth. So here we have a more correct orientation of the scans, and I can look at it from every perspective. To help me view certain things, I can turn off the appearance of the lower model, and now I can just see the upper, well, not the model, the upper scan. So you can see the demarcation line running right down the middle. So that looks good. I'm going to take a look at the occlusal plane view from behind, and I could probably tilt it just a little bit by highlighting this and making that adjustment. So it looks like we're in good shape. I'm going to accept that. And now the scans were correctly reoriented in space, and I can just punch the preset view buttons and get the correct appearance of the models. So here they are. But again, these are scans. They're hollow skins of the digital data. I'm going to convert them into a more user-friendly work model. To accomplish that, what I need to do is select one of those models. Here is the lower. Go to Virtual Setup. Select this button right here for cut and close, and that gives me this green plane that is going to define my model. My objective is to take this green plane and move it down as far as I can, catching barely just the border of the digital scan. And what the computer will do is fill in the rest. So I say next, and here's Maestro generated work model. It captured all of the detail that was there, and it filled in the base of the model very neatly and closed all of the holes. So the lower is done. Let's do the upper exactly the same way. Here's my upper scan. I'm going to orient it sideways. Pull that green plane up to just catch the border of the scan. If I don't like the orientation of this plane relative to the occlusal plane, I can change it. But still, I am catching that small portion of the scan. Say yes. And here is my upper model with a nice little work base added to it. And here it is. These models are ready for the next step. Thanks for watching.